just get that going. Good. So I'd like to introduce the Book Dash team. If you can just switch on your camera and say hi so that everyone can see you. So firstly, we've got Tembi Shangase, who's our executive director, and I'll be handing over to her
Hello.
shortly. Good. Then our next person that I will introduce is Zaib. Zaib Solari, our administrator.
Good morning, everybody.
Zaib is also the head prefect of this meeting, and she will be admitting people, and she will be kicking out meat geeks and autopilots because we will be sending out a recording. Zaib will also mute people who forget to do that. The next up is Zandri. Zandri Klutzinger is our publishing manager, and she is the one driving the presentation. Um,
Hello, everyone.
Then we've got Christine Karusait, who's our finance manager, and in this meeting, she's also our timekeeper. She will be the one alerting presenters when they are about to reach their time limit.
Morning, everyone.
And then our last team member, but definitely not the least, is Sherry Wright, our print and publishing coordinator, who's going to be taking minutes and interesting points from the discussion for us to consider afterwards.
Good morning.
Good. So, I wanted to give you a general overview for those of you who don't know Book Dash yet. Tembi will also say that, but before we get to the agenda, really just to say that we're a social impact publishing organization based in South Africa. We publish affordable, relevant, home language, homegrown books for preschool children, and we distribute those books through a network of distribution partner organizations. These are organizations that already work with young children and their families, either in literacy or in ECD or in healthcare. So the session today really works with that one section of our distribution partners who work in healthcare settings and who distribute our books to the families. So our vision is that every child should own 100 books by the age of 5. That's a very ambitious vision. It's very aspirational and it's a vision of abundance. And I think it serves as our North Star around book ownership and about abundance. But it's very clear that Book Dash on our own cannot possibly achieve a world where all young children have many books. And so we really welcome partnerships. We really welcome, it's a broad church. We welcome anyone who promotes reading for young children, who believes in reading and family literacy practices, who distributes high quality books. So while this session is presented from a Book Dash perspective, we hope to be inclusive, and we also hope to really just make the case for reading and books, and learn from the field how it is working. So over the years, we've seen that our books are used in two different ways by this broad sector called the healthcare partners. The first is as a tool for really for bonding and for closeness, and we know that that underlies the proper development of socio-emotional skills, and that is the bedrock for further learning and for development. So in that kind of context, we see that our books are used to calm children, for caregivers to bond with young children. And this includes scenarios of, for instance, waiting in queues at the clinic for a long time. It includes protracted hospital stays and visiting hours that are a bit awkward, but that are eased through books. And we also know from that kind of use of our books that the healthcare staff really value the presence of books as a way for them to bond with the young children in their care, because it's a joyful interaction around a book and it's not them administering, sometimes uncomfortable or painful, I don't know, injections, etc. So that's the one use of our books. The second way that the books are used in healthcare settings is more, I would say, as therapeutic tools almost, where reading or take-home exercises are kind of prescribed almost by a healthcare worker, whether that's a pediatrician or an occupational therapist, a speech therapist, a dietitian, etc. And we'll hear more about that in the session that Jessica and Teresa will present to us, as well as Miemie's session. We'll come to that now. Um, so those are the two broad ways in which our books are used currently in the healthcare system. And I just want to make the point that the value of sharing books with young children is really derived from the act of reading and the physical presence of books rather than from the content of the book. At this age, the content of the book is not really that important, but it is the closeness between the adult and the child that's important, the engagement, the interaction that is sparked through the book. It's about how concepts and vocabulary are built through discussion and engagement. It's about the shared joy that is sparked by the story and the pictures. And it's about young children, very young children, realizing that text carries meaning, and then the interest that is sparked there in wanting to learn to read, which of course leads to good educational outcomes later on. So let me run through the agenda very briefly because you're going to hear from more interesting people than me um, about how books are used and what the value is. So firstly, the introduction and rationale for the session. Tembi Shangase, our executive director, will take us through that. Then we have a session looking at what research tells us about the benefits of books and reading at a very young age. And Katie Houston, a long-time collaborator with Book Dash, is going to be taking us through that. Then we've got two very interesting case studies. First, the Reach Out and Read model in action at the Tygerberg Hospital with Dr. Miemie du Preez, who's going to share that whole model with us. And secondly, Jessica Runasen and Teresa Gravenstein will be from the Dumore Foundation and the Department of Health in the Eastern Cape, respectively, will be taking us through using books to strengthen ECD and health programming. So it's a slightly more holistic view. Then, if we're lucky, Bukhle Mabaso from the Side by Side campaign will be joining us. I don't know if she's here already. I've lost track of who's in the room. But will be sharing with us what the rationale is behind strengthening Pillar 2 in the Road to Health booklet and including messaging around reading. I will then be taking you through a thematic analysis of our healthcare partner feedback over the years and the benefits that people who are currently using our books find in that. And then at the end of the session, we'll take you through very briefly the different ways that Book Dash books can be accessed if you're not yet a distribution partner. And there, each of our team members will also jump in. And there will be a general Q&A if there's time and a wrap up. But I think I would like to encourage everyone to use the chat for questions and for comments. Tembi is going to be monitoring the chat for us, and after each of our case studies, after each of these inputs, there will be an opportunity brief to do some Q&A and to look at comments that people have left. So please use the chat as much as you want to. And without any further ado, let me stop talking and hand over to Tembi for an introduction and a rationale for the session.
Thank you. Thank you so much, Dorrit, for that wonderful introduction. And thank you to particularly our guests that are joining us this morning, our partners and the keynote speakers, Dr. Miemie du Preez and Dr. Jessica Runnison, as well as Teresa Gravenston. And of course, Katie, we always appreciate collaborating with you. So very excited to having you sharing the insights on why now and what the research really says. My part, I've been given 10 minutes, and I can assure you I am definitely not going to take that long because I think the case studies that are presented in the room today are really rich, and they will spark a lot of enthusiasm, I believe, but also insights on how various organizations can use books within their health settings. So why now? There's plenty of research evidence that's been pointing to the value of introducing children to books and introducing them very early as well. And these benefits are not just for the children only, but also for the caregivers. And this is something that Dorette mentioned in her introduction. They promote the caregiver and the child bonding. They promote attachments and using the story and the books as tools to create that emotional safety, that stimulating learning environment and the joy. So we believe that, the stories, promote vocabulary, language development, and Katie will take you through a lot more on what research has been saying about the benefits. For us locally, I think all of the local participants in the room might remember around last year in September when the Thrive by Five index was released and the research surrounding there. And already there was a call for an integration of early education, health, and parental support to guarantee children's readiness and to thrive by the age of 5. And this is something that is particularly important for children that are not enrolled in any early learning programs. And we observe that the healthcare sector is the one place where these children still where these children can still be reached, or a critical touch point, if I might call it that. And it is also in the very same research study where evidence was presented on how the abundance of books actually impacts children's readiness for school, and that those children who had an abundance of books were performing much better than their peers who had no books at home. So if we can just go to the next slide from Mizanre, um, what the rationale for us as a social impact publisher that has distributed 6 million books through the networks that are in literacy, education, and health. It was important for us at this juncture to share all of the insights we've received from our distribution partners over the years since 2014. We have had cumulatively close to 60 partners in the health sector, and currently active partners. There are 30 organizations that work with children in the healthcare sector, and these are children, in the first 1,000 days of their lives, but also a little bit later on. And we've experienced that joy of learning about the effects of books in the sector, and we felt it was an opportune time to share this more broadly with stakeholders in the ecosystem on how they can incorporate books into their programs, whether it is supporting caregivers and children, or it is really supporting children in those first 1,000 days, and to help set them up for success. And additionally, we've got a very big goal where we want to grow our share of distribution partners in the health sector. Currently, this is about 19% of our distribution, and then we want to grow this to at least 25% of our total share of distribution partners. So we in essence hope and want the session to inspire actors who are curious about how to use books. And that's why we are bringing these lessons from the very actors on the ground who are engaging with the caregivers, who are engaging with the children to share what their experiences are, rather than us only sharing that we are seeing the value. So we encourage you to, as the presenters present, to ask your questions and to, be inspired. We will also share during the session how you could work much closer with Book Dash, how you can access books for your programming, and how we can partner on this big audacious goal we have of growing distribution to the healthcare sector. Yeah, so without further ado, I really am excited to hand back to Dorette and then to Katie, who can take us through what research has said. I've only touched the tip of the iceberg. There's so much evidence out there on the benefits of books to children in the earliest years, and particularly in the healthcare sector. So thank you, Dorette.
Thank you, Tembi. Um, I am very happy to hand over to Katie, who's going to be taking us through a few slides with a summary of what the research tells us. Katie has been working with Bookdash in various roles as a consultant over the years. Um, But most notably, she has her finger on the pulse of all the research around reading, and has written up a very wonderful summary of research for us that is available on our website. I will post the link to that now. But yes, over to you, Katie, for a view on research on the benefits of books for very young children and specifically through the lens of the healthcare settings.
Cool. Thank you, Dorette. Morning, everyone. Really nice to see everyone here. I think just to say, when Book Dash first asked me to start looking into this body of work and pulling it together, I mean, I worked at Nali Bali for a long time. I've been in literacy for a long time, so I was already a believer. But I was quite blown away by the all the research that we have about what books can do for children, not just for children, but their caregivers, not just their caregivers, but people working in the healthcare sector. And these impacts, we often start by talking about the academic or the cognitive benefit, which is there, but that, as mentioned in the intros, there are so many other impacts on bonding and relationships, on socio-emotional well-being, on reduced stress. I mean, I'm an evangelist because I'm really convinced about all of this, that books are really magical. So I want to take you on a quick spin through some of that this morning. I believe the slides will be shared, Dorette, is that right? And I've put links in the slides to all of
Yes.
the original studies. So if anything piques your curiosity, you're welcome. You'll be able to click through and find a bit more. But I think just to set the stage, for those who aren't as familiar with the landscape of books in South Africa, access to books is very limited. It's overwhelmingly in English and Afrikaans, and highly, highly unequal. So the graph on the left here is based on some analysis of National Reading Survey data from a couple of years ago. And the survey spoke with adults, but then we asked them if they lived with children under the age of 10. So that's the adults who live with children. You can see that the majority don't have any picture books at all. Those who do mainly have 10 books or fewer. And it's these very, very small groups that have more than 10 books. So just, the sort of idea of abundance is very hard to come by in our context. We also found in that National Reading Survey that only 8% of South African adults said, I've checked out a book from a library in the last year. And that's all books. That's not just children's books. Although I think 58% of people said they could access a library. We know from another survey that UNICEF did, which was focused on parents and caregivers of children ages 0 to 6 a couple of years back, that only about a third of parents or caregivers say that they read with children. Obviously quite linked to the fact that many people don't have many books to read in their home. And this is a stat that absolutely shocked me when I first learned about this, when we put together the National Reading Barometer 3 years ago. This is based on the publishing industry surveys. The most recent survey, which was 2023 to 24, it was at 3% of trade publishing revenue came from books in African languages. And by trade publishing, we mean things that aren't academic. They're not textbooks. It's all the other books, the sort of enjoyment stuff. That figure is actually way up from 2 years prior when it was less than 0.5%. So it's moving in the right direction, but it's still got a long way to go. You can go to the next slide. And I think, this has also been touched on in the intro, so I'll move through this quickly, but I think many people have probably observed in their own practice that book sharing with young children has so many benefits. It improves oral language through verbal interaction. It improves both what the vocabulary that children can understand, the receptive vocabulary, and what they're able to say, which takes longer, the expressive vocabulary. It improves the focus, the kind of patience, the ability to manage attention, which is so important when children get to school, that they can focus on something for a period of time. It broadens horizons. You can learn about new things. The secure attachment has already been mentioned in the introduction, but that is so important because it supports later happiness and social competence. And there's some really interesting research about how book sharing with babies and young children can reduce caregiver stress. And I think that's quite relevant in a healthcare setting where there are often high levels of stress. If you've got an ill child, you're dealing with a chronic illness, you're dealing with developmental delays and the challenges that come with that. And when caregivers are less stressed, they can be more responsive and present for their children. And that, of course, is better for children's development as well. And this slide is not meant to disparage all the other wonderful ways we have of supporting and interacting with kids. Storytelling, singing songs and rhymes, just chit-chatting is so important. And in a book poor context, we need to promote it as much as we can. But it is just to note that books have a particular magic. They bring certain things to the table that are a bit different from all of these oral modes of interaction and complementary. Books tend to have more diverse vocabulary and more complex grammar and sentence structure. I've got a 5-year-old, so I get asked all the time, Mama, what does that mean? They're words that I would never say in everyday life. There's more words per minute used when sharing books generally than these other types of interactions. And there is some research linking, children that hear more words in early childhood tend to do better later in terms of literacy development. Book sharing also increases those serve and return interactions. If people aren't familiar with that concept, I think most people would be, but just the idea that you're following the child's interest. And even before kids can talk, you can see their eyes went over here, they pointed, they grunted. It makes caregivers more attuned and kind of intuitive about being able to pay attention. And again, in a context where children might be nonverbal or have developmental delays or just be quite young, the ability to follow the interests of the child and to have that back and forth, that's what develops that neural architecture and the communications, the social skills, and so many pieces that need to be there for the later development. And they're also a nice tool to talk about, feelings and emotions. Sometimes there's hard conversations you need to have, conversations about death in some instances, or illness, or saying goodbye to a loved one. And sometimes a book can be a very helpful tool. We've had feedback from some of our partners that the book circles help people to deal with death after the COVID pandemic, as an example, in rural KZN. Can go ahead. But I think a question that Book Dash often gets, and it's a fair question, it's an important question, is like, just if we give away books, how do we know people will actually read more? And I think it helps to look at this through the lens of a behavior change. Reading with children is a behavior. And just like a lot of things that are good for us, like eating healthy food or exercising more, we generally know that we should do it, but it's hard to do it. And sometimes that's because of a lack of access, what we saw in the first slide. In fact, I think in this situation that's the biggest driver. In South Africa, we know there's a high degree of awareness, this is from the National Reading Survey, that yes, we should be reading with children. People know it's a good thing to do. But again, only a third of parents are actually doing it, linked to the fact that very few parents have those books in their home or coming home from a library. This little diagram here is based on some qualitative research from a project Book Dash was involved with, along with WordWorks and Nalibali in the Eastern Cape, called Yizani Sifunde. So this was our sort of qualitative internal evidence and some of the case studies that were done. We found that we described it as the nudge effect. And this is actually backed up in the research as well. The idea that when a book is physically present in the home, the child is usually the one who then picks it up and says, read to me, read to me. And so with a parent, okay, they'll sit down and read. And when the parents saw their children reading, they would, wow, I didn't know my child knew that. Look, my child's so clever. They're learning a lot at school. It's nice to see your child happy and excited about learning. So it was a positive experience. And this meant they would do it again and again. And this kind of solidified the behavior into a habit. But it was the presence of books that enabled that to be possible. If you know it's good for you, but there's no books in your home and you're a busy parent, it's going to be much, much more difficult. So this led to more frequent reading in the project. And I think this is echoed in a lot of research around the mechanism by which books lead to reading. So this study on this slide, diving into some of the sort of more peer-reviewed academic stuff, I've just picked a couple studies that I find really interesting to share today. This slide is a bit complicated. The rest are not quite as busy, but this was a meta-analysis. It was done in 2020 by Dubant and some others. And they took 44 studies that were based on 3 early book gifting programs. And all of the studies they looked at had to have a control group, so a group that didn't receive this intervention as well as a group that did. And they looked at studies about 3 different book giveaway programs, all of which started, I think, in the US or the UK. So they're mainly happening in contexts that are not quite like ours, but I know that there are local models. I think we're going to hear from Miemie just now about a local implementation based on the Reach Out to Read model, if I'm not mistaken. So it is happening here as well. But anyway, this the Reach Out and Read program, as it was developed in the States, is where pediatricians or nurse practitioners would give away books when children came to a pediatric clinic. They would usually recommend and demonstrate book sharing as well. And a child would maybe get 1 book every visit, up to maybe 10 books or so, varies depending on the site and the number of times they come. Another model that's here, and I think we have someone from book trust in the UK on the call, which is fabulous, is Bookstart. And this is, there's about, I think, 30, if I'm not mistaken, different Bookstarts around the world, but it generally is a once-off gift of a couple of books and maybe a flyer when children are quite young. They're infants or babies. And that's usually given by a community health worker, a librarian. It does vary depending on the context. And then Imagination Library started in the States. It would never work here because you get one book by post in the mail once a month up to the age of 5. And I know our postal service probably would struggle with this. But there's no personal contact in this model. It's just book comes in the mail once a month, so quite different. So they looked at all these studies and kind of sorted which have which characteristics. And when they aggregated the effect, they found that it had a moderate effect size on several of the key outcomes. So the home learning environments had a lot more books. They were more conducive to learning. Children's interest in reading increased. How often they read with their parents increased. And their literacy skills increased as well. And I think, Cohen's D is a standardized way of looking at effect sizes. We're not going to get technical, but I think just to say that this is like a moderate, kind of a small to moderate effect size. And we wouldn't expect a massive effect size from an intervention like giving away books. But it's very clearly there, and it's very clearly moving in the direction that one wants to see for all of these outcomes. The authors of the paper noticed that it was the programs that demonstrated or had an info session or had multiple personal contacts tended to be more effective. And there was a very interesting hypothesis that came out of this paper. They said that we think that giving away books in healthcare settings may be more effective because, as you can see, the Reach Out and Read studies that were included in this bucket of the 44 studies had a bigger effect on the children's literacy-related behavior and skills than the other two models. Look, they all had a positive effect. They were all, impactful. But they said it's not just explained by the demonstration or the multiple contacts. And there's something about getting the advice from a health professional that may make parents take it more seriously and be more likely to implement a change at home. And I think that's a really interesting, I guess it's a hypothesis. They didn't have the data where they could prove it in a particular way. But I think it's a really important point. And I think there's, when we talk about experience on the ground, we can hear if people agree with that hypothesis. Go ahead. This was mentioned earlier in the introduction. So this is just the data from that Thrive by 5 index that came out last year about the relationship between the number of books children have at home and their total ELOM scores. The ELOM is a locally developed tool that measures children's early learning. It assesses 4-year-olds, and it looks at outcomes in gross motor skills, fine motor skills, early literacy and language, numeracy, and cognitive and executive function. And it is in all of our local languages, developed here, normed to the South African population. So, you can see the positive impact there. I won't go on about it, but just to note that only 4% of children in the study, which was a nationally representative survey of children in early learning programs, had more than 10 books. So we see that those 10 books or more have a big impact, but we also know that that is the minority of children, echoing those stats we saw earlier about access. So this study I'm going to speak about now was really interesting to me because, yes, more books is great. And, Book Dash wants abundance. They want 100 books for every child. It's a beautiful vision. But I think when we talk about a healthcare context, we're not always going to be able to see the same children more than once. We're not always going to be able to give many, many books to the same home. We have a lot of people we need to serve. There is evidence showing that a few books or even just one book can still make a really big difference, especially in homes that have no books or very few books to start with. So this study that I'm going to mention, it was done in 2019, was based on data from more than 100,000 children in 35 countries using the UNICEF Multiple Indicator Cluster Survey. And those 35 countries were mainly lower income, lower middle income, or upper middle income. There were, I think, 3 more affluent countries, but most are, a group that could be relevant, I guess, for us here in South Africa to compare to or learn from. And they looked at whether the household had any children's books. They had a binary 1 or more versus none at all. And then they looked at a couple of questions. They asked the children, early counting skills, early letter recognition, etc., and created an index from those few questions about whether they were on track in foundational literacy and numeracy. And the headline here is that the children who had 1 or more books, even just 1, were almost twice as likely to be on track in foundational literacy and numeracy, even after they controlled for things like the mother's education level, the household wealth, the urban versus rural, the child's age in months. And of course, we can't control for every factor. We can't see all of the factors that make a difference. Every research methodology has its pros and cons. But another thing that was interesting in this study is that this difference was even greater in lower income countries or countries with very few books. So adding one book in a sort of very book poor context or in poorer households can make an even bigger difference. The ratio was more than 2 in that group of the lower and lower middle income countries. But this picture on the right is just showing that we still, across these 100,000 children, only half of them had a book and only a third of them were on track. So there is a long way to go, not just here in South Africa, but globally. It is a big challenge. And which is, I know it's not only South Africa on this call. So just, I guess, to reiterate how great it is to be having this conversation more broadly. 2 more
Katie,
points I want to make. What's that?
just wrap
Oh,
up.
I'm out of
We've got
time.
about a
Cool.
minute
So this is just
left.
very quickly to say that, of course, the more support we can give families, the better, but even light touch support can really help. I won't get into detail here, but essentially it was a study in Kenya that tested different amounts of support. And the families that only got books saw improvement in reading and comprehension, as well as groups that got books and a workshop and a home visit. They had these different groups. So the once-off workshop improved things a bit, but all of the groups saw a positive impact. So again, in our healthcare context where we might not be able to give the Rolls Royce of, 2-hour workshop 5 weeks in a row to parents, there's still a big impact with light touch interventions and support. And the last thing I wanted to mention very briefly is that there's in the literature, looking beyond the benefits to the children and the families, there's also benefits to health systems and providers. So the Reach Out to Read program in particular is a lot of research. It's been running for 3 decades. Giving books in a healthcare context can increase attendance at well child visits, which can then increase vaccination rates. It can help assess children's development. There's a little quote from one of the clinicians interviewed that there's a lot of information, verbally and non-verbally, you can get from putting a book in front of a child. That in some instances led to more developmental screening, better able to detect children who may need support earlier on. And there were also just a lot of mentions that healthcare providers found it more enjoyable, their work more enjoyable, more connected to patients and families, enhanced the sense of meaning in their work, boosted clinic morale. I can't speak to those effects because I'm not working in a healthcare setting, but I'll be interested to hear from those who are about whether any of this resonates with them. And that is my last slide. I'm all done. Thank you.
Thanks very much, Katie, for that kind of flyover of the research. I did add the link to all the research that's on our website, and it's very easily digestible, I think, and very useful to wrap your head around that if you're interested in more detail. But for now, I'd like to thank Katie for that input. I think it really helps to frame the work we do and everybody on this call is interested in from a theoretical and kind of proven evidence base, and that's really important. Before we move on to the next case study, I wanted to double check whether there were any comments or questions for Katie about the research. Okay, well,
No questions on the
if
chat.
yes?
There's no questions on the chat.
Okay, wonderful. So let's move on. I'm very happy to introduce Dr. Miemie du Preez, who is a neonatologist at Tygerberg Hospital. She's been a distribution partner of Book Dash for quite a few years, and but the project is wider than just the Book Dash books, and I think that's the point I also want to make is that Book Dash books can sometimes provide a kernel for something bigger, more holistic, and very impactful. So, Miemie, over to you. We are very keen to hear your story.
Thank you. Let me see if I can get my slides up. There we go. Can you hear me?
Yes, we can.
Okay. So for those of you who haven't met me, I'm Dr. Miemie du Preez. I'm actually a small baby doctor, so that means my subspecialty is I'm looking at very small babies. I'm a neonatologist. So I've always been in awe of books and words, and actually the ability of books and words to shape human interaction and, of course, education. And also, like everyone else here, I'm very worried about the South African context with we know our educational outcomes. And looking at the model, the health model, the reach out and read model, I really thought, well, why can't we do it? Or can we really do without something like that? Also, we don't have books almost all developed countries have some program where babies get given books and that actually boosts literacy. And I think it's inappropriate to recommend shared reading in circumstances where parents don't even have food security. But on my slide, you can see the tiger, that is Tygerberg's tiger, and the doctor tiger with the stethoscope. And you can see our young patient there getting a book, maybe a book dash book next to him. So children are, I'm not going to repeat everything that Katie has said because thank you for that presentation. It was excellent. But children are made readers on the laps of their parents. So a child can't end up at school without ever having seen a book, and we expect them to know what to do with it. Language grows through relationships, but relationships also grow through language. And in South Africa, I do want to make a disclaimer. We have complex problems, and complex problems needs complex solutions. So also, I absolutely, I believe in the power of books. But if we have moms going off to work at 4 o'clock and arriving back at 8 o'clock, it is quite tricky, the books. And a lot of our children's really enter school very disadvantaged. So we need earlier points of intervention and we need numerous interventions. So why the health facility? So indulge me again. I have a dream, and I think I might have shared it with Dorette. I really dream of a time where almost all children, or almost all pregnant moms in South Africa actually attend ANC antenatal clinics. So I dream of a time where people will get books already in the antenatal clinics, or at least when the baby is born. And then on repeated visits to the clinics, because they do attend the visits, they do attend the clinics for immunizations, that they will get given more books and more books till the discharge. But yes, the health services are uniquely placed. They reach early and they reach repeatedly, and it's equitable. And it's easy to incorporate this book giving into routine practice, but I will say something about that later. And then also the healthcare worker, unfortunately, has the power that parents are more likely to read to their children if a doctor or a nurse said, read to your child, it's good for them, than if a lot of other people say it. So we can abuse it a little bit. So what is the idea? The idea is to give a book that a child will love. And all of these pictures are actually of our patients and of our doctors. So it needs to be a book they can love. It needs to be a beautiful book. And then we actually do try to show them how to share, because a lot of our parents have never been introduced to book sharing. So just to give a book and say you need to read to your child, that doesn't really work very well. I know Book Dash doesn't agree with me on this, but in front of the books that we originally distributed, we actually had the reading tips that we got from the Nalibali website to actually give ideas, to say you show with your finger and you ask what, why, where. And Book Dash has similar little leaflets, but yes, you'll see if I show our packages of books, we still paste those on top of it. So we encourage making it a habit. Really, to say you have to read to your child, you should actually say, and it's true that children that's read to at bedtime actually sleep better at night. So to try to make it a habit, we have tried a script, like giving a medicine script to say, this is your script, and then on the script it actually says, go and belong to a library. And we actually have the directions to belong to a library, because I think libraries are amazing, and we have amazing libraries. We should get the children into the libraries, or the librarians into our healthcare facilities, I think. So we on the script it says, belong to a library, and then it says read daily to your child. Other units have tried the tick sheets, where the child can actually come with the times that he has ticked, and then they are rewarded for it. And then we repeat the message. So we integrate it into clinical care. Like I think Katie also had this slide. If you put a book in front of a child, you can already see how the child responds. So use the tool as a book. It's brief, and it literally takes 30 seconds. Say we put the book like this, and then we show with our fingers to read like this. And yes, you've heard all about the advantages and the amazing things that book can do. But it's also a little bit about the conversation around the book. So yes, doctors are busy. Nurses in South Africa are incredibly strained as it is. So we really, it's again a plea. We need to get the other organizations also involved for support. So you've seen this likewise slide. It's the power of the healthcare worker. Yes, parents are much more likely to read. They will read more often. The language will improve. And most of all, it is something that parents actually enjoy. So the differences, we've got huge differences with starting a RAW program here. We have multilingual parents, and this is really a problem. We offer them books in their own language. A lot of parents will say, well, first of all, I don't read isiXhosa. And a lot of parents will actually ask for specifically English books. I do believe in home language. I also believe in introducing English quite early. I mean, that's the language that makes the world goes round. But we really try to give isiXhosa books to our isiXhosa moms. We love the wordless books. Also, what we found is you can't just give a wordless book and say, talk to your child about it. You really need to mirror and explain a little bit how to use it. The caregivers literacy, of course, it's not really a problem on the wordless book. And even on the other books, we tell them, just make up your own story. Most moms are literate in South Africa. What they don't have is good, fluent reading skills. We also tell them that the children actually don't care how well you read, to play around the books, to make a game of it. And really, we try to sell it as fun. If you're trying to sell it as a brain enhancing thing, we found that not to be so accurate as to say, let's just give it a go and let's just play around it. So just a little bit on who receives it, where, when, what we did, and what we told parents to do at home. So currently, we are distributing it to all our patients seen in our outpatients. We basically have a big outpatient department, and also to make sure that all children that is admitted receive it. From time to time, and this is a distribution problem, we try to hand the books out to the newborn babies. It's quite labor intensive, and even though I have a paid assistant, it's difficult for her to get around to every single newborn baby. But that is definitely something that we are aiming for. We really think that if we can give the books out at birth, then at least we can assure that every single baby leaving here leaves with a book. So the material, we've got your wordless books and the picture books. I believe in the power of nursery rhymes. I think nursery rhymes are very easy for parents to read. So we actually made our own nursery rhyme books. Um, and for the babies, I still think they are really wonderful. I loved Book Dash's baby books with the sounds and the things. I wish we could bring them back, but maybe we'll get money and have them printed by ourselves. We also have book trolleys. So the National Library has been very good to us previously. So we have a vast array of beautiful picture books, and it really makes sense to show parents what's available in libraries. So we will take the book tours around to the sometimes to the waiting rooms or to the wards, and then parents can pick. Of course, those books needs to come back. So the delivery is from anything from the doctors, the nurses. We try that. We've got speech therapists. We tell literally everyone. My assistant really makes sure that the book boxes are filled. I'll show you just now. The volunteers. We can't do it without volunteers, but volunteers have lives of their own, and also it costs them a lot. So we'll get volunteers that will work well, but then sometimes it's quite difficult to retain them. And then we've got the medical students. So currently, the residences pick social projects, and luckily most years we do get picked, and then they will also come around with the trolleys and read to the baby. So our core behavior is to play around the books. It's not so much about the reading. Really, you can skip the words. Even if you can't read well, that's perfectly fine. But to point and wait for the child to respond. So here you can see, yes, we do store them in the books in protected rooms. We've also learned that it's best to make the heading so that you can see what is inside those boxes to the front. Those are our books. So we package our books in a little brown bag, 3 of them. And then those are Nali Barley's reading tips. And then on the side, you can see the boxes. So the boxes are arranged in the 3 main languages. And usually at the back, we have a few Zulu or other language books. So these boxes are placed into the doctor's rooms, the consultation rooms, and they are filled up regularly. So it takes a village. These are my volunteers. Some of my volunteers, they are the champions of the trust. So they will come and sit in my office with me, and we will sort out the books. But yes, it's an ongoing thing. Also, I think you need to use anyone. You know, we've got some doctors that will make their children arrange the things and put it in bags. But yes, it does take some time. So, and the boxes needs to be filled. No, if you want to sustain this project, then doctors don't want to have to run around and look for the books. We need to make sure that the boxes are full. So we do have the buy-in of the nurses in the outpatients as well. Here's my students. So there's the trolleys. You can see the trolleys go down the corridors, and then the students also come with new books that they also run book drives, and then they also hand out other books to the children. So the South African studies, I'm not going to go through it. I think she's covered it, but there's my dream. So my dream is that we hand out the books at birth. And also, I think the libraries really, we need to encourage parents to go and visit their libraries. There's amazing libraries. So what we did for my studies, we actually asked the parents at follow-up for their library card. The front of the nursery rhyme book has a referral to the library. So, and then when they came back, we said, can we please see your library cards? I think once moms have gone to the libraries, then they usually sold it. So the dream is that if they come back, that we can give more books. And I mean, massive, if you do massive prints, then the books are really not that expensive. So this is just my own private PhD for my premature baby. So yeah, it was just about the moms actually read nursery rhymes, sang them, rapped them, or whatever way produced them to their babies. And it was very feasible. Almost 90% of the moms did it. We also had a script to read, so they ticked basically every day, and moms read an average of 7.4 times a week, so it was very acceptable to them. And then on the results, what we found is that we did quite complicated testing of eye tracking, and we could really show a big, a moderate to large benefit on children's bonding and altruistic behavior. So really very positive results there. So lastly, I really think health facilities are missed opportunities for early language and bonding. It's feasible, and it's a simple intervention that may strengthen caregiving and child development, but it needs a champion and a buy-in. I'm just going to show you this. I hope you hear the sound.
So many times it happens too fast. You keep your passion for glory. Don't lose again. Only Jesus survive. Must fight to come alive. It's deep out of time. I will fight. I've been up to the terror of our house. Into the last hours of the light.
Lastly, that's my famous quote. I do believe that words and books are as important as breast milk, immunizations, and healthcare. And my dream is really because even the healthcare, with the healthcare as it is, doctors don't have time to package the books and sort of make sure that the books are ready and available to be distributed. So luckily I can afford an assistant. So I have someone working 4 days a week that does that for me. But I dream about a world where some of the other book distributions will come into the hospitals and we can all sort of work together. I do think we need a single plan to get books into the hands of our youngest children. Thank you.
Well, thank you so much, Mimi. I think you would have seen all the hearts floating about because and applause and lots of very positive reactions. I think it's incredible to see a model in action and you know the results speak for themselves. Those photographs are just amazing to see how big the scope is of your distribution and how consistently you do it. And so, yeah, I think a few things from your session that I want to comment on. Firstly, I think the link that you make with libraries, that, you know, inviting librarians into the hospital is one way of doing it, or, you know, introducing, linking parents to other support networks after they leave the healthcare. That I think is incredibly important. I think the point you make about how busy the healthcare staff is, the nurses, the doctors, and how stretched they already are, and to be realistic, I suppose, in how one thinks about book distribution in a busy healthcare environment, and therefore your call for collaboration with other organizations, and I think for for kind of working together. The wordless books that need to be mediated, I thought that was a very important point. Our wordless books are incredibly popular wherever they are, because I think it takes the sting out for parents who feel that they're not good readers. They can play with a book if it's wordless, but they need to be shown how. Some modeling is required. So I think that was a very useful point. I love the core messaging of playing around the books, using the books as a tool for engagement and interaction and fun. I think that's something that we can definitely take forward as a collective. And I love the fact that you made your own nursery rhyme book because that's a need that you feel you have. I love the fact that you add the Nali Bali reading tips to the packs of books that you hand out. I think it's everybody needs to design their own manifestation, their own incarnation of a book gifting and a book giveaway project. And I think you've given us some very good, wonderful actually suggestions and ideas. So, Thembi, is there anything in the chat? Questions?
No questions, but really comments echoing just the value of giving the books in the early years. We've got from Jackie from Hatch, who also just highlighted that they give out their books at community antenatal classes, as well as to mom in the maternity wards at birth. Katie applauding just the work that you're doing, Dr. Mimi. She says it's so incredible to hear and see. And the question is if you have anything. Do you have anything you can share about about the research you have done on feasibility of uptake and outcomes that were presented? So that's really the core question that's coming there. Any research on feasibility, uptake, and outcomes that Dr. Mimi presented?
Yeah, so I've sent, so it's in my PhD thesis. We have submitted, we're just waiting for publication, but I'll send it to her, then she can have a look at it. Thanks.
Thanks so much.
Just on on the nursing, I think some time ago, someone, I mean, and it came from a good place, actually had, I don't know how many I think it was Book Dash, or maybe it was Makulu Trust books printed, and then they were delivered at the clinics, and the clinics really sent them back. The clinic said, what are they supposed to do with it? So this needs to be, it needs to be well orchestrated, and we, maybe later, but we can't really just dump the books in the clinics and say hand them out. It needs someone to actually show how to do it and actually to help with it. Thank you. Thank you so much for the opportunity.
Yeah.
I'll also put my email in the chat box. So if there's anyone that wants to know anything more, then I'll send it to you. Thanks.
We've just got another question that's come through from Kathy Gush. Is the nursery rhyme book available somewhere?
Yes, it's available from me. It's free. So I'll say a little bit about the nursery rhyme book. So most of the nursery rhymes in the Afrikaans and the English, actually, I took it from Nali Bali's website. We also had a Kaap's nursery rhyme book made by the Trantral brother. So you may know about him. It's an amazing book. I think subsequently, I've got the copyright, but I'm very welcome to share it with anyone. So subsequently, the Department of Education is also using it, and the the isiXhosa nursery rhymes also came from Charlotte Block's Nali Bali. I think it was part of her PhD or her master's. So yes, I have it. So you've got my email. I think I'm going to send it just now. So if you send it to me, I will send you the blueprints for the books. But unfortunately, I can't print them for you and hand it out to you. Thanks.
Thank you. Right. No
Thank
more
you.
further questions.
Yeah, that's wonderful. And I think Mimi, you can send everything to me also, and then I can make sure that people get it. So we if anybody is looking for any of those resources, you're also welcome to email us at BookDash. But yeah, that was a very, very interesting input, and thanks for that, Mimi, and good luck. Right, now we're going to move on to our next case study. So, Zandri, if you can take us back to the slide just to introduce our next speakers. Great. So now we're moving on to looking at how books are used to strengthen ECD and health programming. And we've got Dr. Jessica Runarsson from the Dumore Foundation and Teresa Gravenstein from the Department of Health in the Eastern Cape. I see I made a spelling mistake with your surname, Teresa. I'm very sorry. I'll fix it now. Over to you. We'll stop
Amazing.
sharing. Yeah, we'll stop sharing so that you can.
So lovely that you shared that picture. I'd forgotten about that picture in my scurry for finding some new novel photos to share. That's such a goodie. So yeah, thanks for sharing and lovely to be here. I'm hoping we can build on what has just been shared because it's so wonderful to see the different ways in which embedding literacy and books into a health space is not a one size fits all, but really finding the right way in and how to sustainably maintain that relationship. So yeah, I'm really privileged to be able to be presenting with Teresa. For so many reasons, her and I have journeyed in this multidisciplinary journey together. So this feels like quite the milestone, I must say. I thought I'd just give a little bit of history into where we began with Book Dash actually, and it was back in 2019. Can you believe that, Dorette? And we were working, or I was working quite closely with some of the OTs at Bethesda Hospital in KZN, and really seeing the ability to find champions within a facility. That was my first experience. What was so interesting was they were so panicked about the report at that time, and I remember thinking, "Oh, but this is something that I do all the time. Like I can do that. Like let's do this together." And it was such an amazing year process of just showing the team, the OT team at that time, like these are the reports these are the types of information you could collect that will help me with this report. And a real shout out to Book Dash for making the reporting process so peaceful and not like onerous, but it was such an amazing capacity building opportunity because I think the OTs, they were quite used to collecting stats, but they hadn't really been looking at their interventions as like literacy interventions necessarily, or how they were distributing the books and capturing those qualitative stories that Book Dash's report often asks for. So lots of lessons there. Fast forward to 2020, of course, that was the time of COVID, and really seeing the ability to link in with clinics and outgoing services out of the hospital setting. So that relationship has gone from strength to strength, specifically in the cerebral palsy clinic. So being able to use the books with special needs children, really just to empower the parents with confidence. Again, we used mostly wordless books, but because it was in Gauteng, also such a mix of translations required, and it's been amazing to be able to order a variety and give parents choice to say which of the books would you like. And often they do pick the English, but sometimes not, and that often surprises me actually at how excited they are to see like a vendor book in the stash. Teresa and I then started working on the Saka Setu project, which we'll give you a bit more detail on in this presentation. This was our breastfeeding support group held in the Eastern Cape alongside UNICEF and the Department of Health. And this was really my first experience in seeing how magical it can be to support community-based health programming. So we'll unpack that a bit for you. And then fast forward to today, we've really continued that model using the breastfeeding support groups, the nutrition education programs, and the local clinics as our distribution channels. Some pictures from the journey. I think I mentioned a bit about the dietetics department and the OT department came on board. And I loved what Katie was sharing about the nudge effect, because we really did see that play out. And in being really people-centered, the books allowed the professionals to really be able to spend like a bit more quality time, even if it couldn't be, a full shared reading experience, but it gives the session or the time interaction with the patient, just like a real honor and a real sense of worth when you're able to give an exchange of, look at these books, and this can enhance your time within a ward or a clinic. Where the programming part came in was when we started collecting data around nutritional status and ECD indicators. Teresa and I, partnered on an article that we published. I mean, it's like 2015 now. It's almost 10 years ago. But what a gift to see the link between developmental outcomes that we know are present in the Road to Health book and are so front of mind in the ECD world, but aren't always linked or associated with the health outcomes as overtly as how we saw it in this time. And I thought I'd give Teresa an opportunity just to share about what that was like to partner with, I guess, the social work education space. And then this picture that we're sharing with you was one of our most successful groups, where the mothers just couldn't get enough of the health information, and the books were such an amazing take home. So yeah, I'll let Teresa share her story. Go for it.
Yeah, hi everyone. Yeah, so for those that didn't see the introductions, I am a dietitian, so working in the clinical space, community clinics, various clinics around PE. And this was just an amazing sort of breakthrough, I think, for us specifically here in the Eastern Cape, where we had this like chance at multidisciplinary teams outside of the health sector. And it was just amazing to see how the community like grabbed this with both hands, that we had this opportunity to reach these parents and these families and actually all caregivers. And they were so interested in everything they could possibly do for their kids. I think we are so used to this very hierarchical sort of treatment plan where the parents and caregivers are just handed this information from up above, and they're not really equipped with what to do with it now, or they're just told this is what's happening with your child, the end, whereas here we're handing them the tools and the knowledge, and being able to partner with other sectors. And it was sort of this whole program around the development of the child as a whole was a very new thing for us in Department of Health. I think we're so used to working in our own little silo that it just blossomed, and it's opened a lot of other avenues for us here, specifically in Nelson Mandela Bay as well. Yeah. So, I just think for us, we started the Soccer SA2 parenting program, where we trained mentors who were just regular moms and grannies on breastfeeding. And then with breastfeeding, we were able to add in all of these extra little tidbits of information, like things on HIV and AIDS, bringing their children to well baby clinic visits, just sort of other information that was fitted in with the breastfeeding. And then that linked to such a bigger picture as well. So that was where your child development came in. It's where we could bring the books in. It was just so amazing to see how the community took this information and ran with it. And these women that we trained actually became such champions for this cause. Like, it was, it gives me goosebumps thinking about how they just became so passionate for breastfeeding. And I just thought this was amazing. And if we could create this sort of response to breastfeeding, can you imagine if we started integrating it into more and more of our programs around other topics too? So that was our parenting programs. We don't only use it with this sort of thing. We also use it in one-on-one sessions. We use it in our clinic-based talks. So we, as community dietitians, do a lot of group education talks in the waiting areas of the clinics, in the general waiting areas, as well as in the pediatric sides, on different topics. Just depends on whether there's a specific health day, or if we've got a campaign going on, or if it's just a quiet day at the clinic that we're going to chat to everyone. But the books became so valuable here. And I think it was Dr. Miemie that then said that, or was it one of the earlier presenters that then said that the hope is to increase well baby visits, clinic visits. And we totally saw that. We really did. The parents saw the value in the books, and the children saw the value in these books. Like was mentioned, they don't just sit there in the waiting area being bored, or wasting precious, valuable time that we could be sitting reading and interacting with our child, instead of just having the phone out on Coco Melon on repeat, which drives us all insane. But yeah, to actually see the moms actually then sitting there, spending the time with their child, pointing to the pictures, like you mentioned, it was really, really wonderful to be seen. And like I said, they do see the value in those books, and it helps to sort of keep the children entertained and stimulated during those long waiting times, because unfortunately that is a reality. And the parents are also very much willing to listen and to participate if they know that there's going to be something valuable given at the end, which is usually the book. We also use the books in our ECD nutrition training, which we do a 3-day training of ECD practitioners. And we actually give them enough books to take home for each child in their class. And we specifically give enough for each child so that the book isn't just kept in the classroom, it goes home with each child. And it's lovely to see some of them use the books as sort of little graduation presents when they're moving out of ECD into grade R. And it's just the photos that we get, the feedback that we get is phenomenal, and they're just so excited about it all. But with all the benefits, we also do have some challenges, which is, I guess, par for the course in the state arena. So one of our challenges would probably be space and storage of the books. So we sort of land up ordering a couple of boxes, using them when we can, like almost as soon as we receive them. And then we have to wait a while to order some more. And then when they arrive, we can use them again. Sometimes, like mentioned, we have this misunderstanding of the books that the nurses or the other healthcare workers are sort of like, what do I do with this? And it does come from the nurses maybe being overworked and definitely understaffed. So that's where the allied health workers, I think, are a huge benefit, because we're going to be working with the children very closely. We're not, usually we're working on more of an appointment basis. So we have that extra ability to work with the children one-on-one, and not be in too much of a rush. So I think OTs, speech therapists love the books as well. The dietitians, anything, it increases their desire to be at the clinic, which is generally a place which the moms and caregivers, I think, dread having to lug their children to going towards. So it's really, really lovely. And like Jess said, like the reporting is quite easy for us. We get consent from them before we take the photos. We do have like just a general photo consent form that us as a dietetics team use, that they just quickly sign for. And then we take photos. We just keep that as a record, and they're very much happy with that. So yeah.
Amazing. Yeah, thanks for sharing some of those stories, and the build that we've made since that time is that this didn't need to be a program on its own, but we really wanted to embed the idea that reading together could be part of nutrition education, could be part of child health education. And that's been really amazing to see how easy it is, or as it's as easy as we want it to be. We jotted down some lessons that we've learned from this journey of collaborating, and I thought I would share this with you all today, because I think part of this journey, almost or over 10 years of collaborating with the Department of Health, has been around creating the relationships and seeing shared understanding. It doesn't always play out the way we expect. And I think that kind of grit and tenacity of like, let's go back and explain to the facility manager, or if storage is an issue, we found ways around that over time, which hasn't always made like logical sense, but it's made like safety sense for the resource, for example. And we've really worked at, I guess keeping the main thing was that we wanted a vision for young children and our health professionals to engage on this topic of literacy. And then all of these amazing things happened. We saw health moments as learning moments and also care moments. So yeah, it's so amazing to hear how often, the mother clinic has come up, or the antenatal visits, or breaking assumptions that ECD is just for learning, but that ECD is also a health related like area of work, and ECD is far more than just ECD center work. And so that's been a lesson for our teams. Seeing the books as really versatile. Sometimes they're quite incentive driven, and when we use it as a teachable resource, but it's also been so amazing to see the allied, specifically the OTs, use the wordless book specifically for patterns and numbers, color recognition, and even in the special needs adaptions, some of the feedback has come through around, recognition of everyday objects. And I just thought that was amazing that that's what they were looking for. Yeah, so the wordless books have been really helpful regardless of literacy level. Some of the other lessons are around caregivers, value being shown how to use the resource rather than just being handed out, like not just receiving them. So that has taken a bit of time to support and capacitate. We've also used them in research instances if we've done some health research. And again, not just letting it be an exchange, but turning something that might be perceived as negative. Like sometimes there's a negative association for children in being measured, or weighed, because they see it as like, oh, it's a doctor that's doing this, or it's a nurse. And there's that negative stereotype, and allowing the resources to really be a transactional, something more than transactional, but also relational. And then lastly, to share with the room today, just around how multidisciplinary collaboration does take time. Yeah, and an understanding from one another's priorities. What the nurse is prioritizing might not be what the dietitian is prioritizing, may not be what we in a social workspace are wanting to prioritize. And so embedding hasn't been about replicating. And if you take nothing else from what we've shared, is that it has been quite the trial and error of finding the right inroads versus just choosing to say, oh no, this is like too difficult to embed. And so I think that really is the success story. And then some of our qualitative responses, which I've been tracking over time, is when parents or the breastfeeding support group mentors that Teresa was mentioning share about the book specifically, they often speak about the shapes, colors, and numbers on the page. And I think that's really an interesting finding, as well as the fact that the books could be taken home. And that it's fun. It makes talking about vegetables and fruit and colors. We had a lot of fun arguments about the colors. And I just thought that was a really nice way of showing how meaningfully these groups are engaging on the stories, and coming in for a landing here to say that the parents, also didn't know how to read books to their young ones, and they were happy that the session covered that as well. They learned different ways of how to read books for their children in different age groups, from pregnancy till 5 years. And when children are young and don't know how to read, we create stories using the pictures in the books, and we still sit with them. And I just thought that was such a story of ownership, saying we, and talking about the children that might not necessarily read yet, but can still participate. So I hope this was full of, or sparked some great ideas for you all. Teresa, I'm not sure if you have anything else you wanted to add there.
No, I think you wrapped it up. Thanks, Jess.
Amazing.
Thank you so much, Jessica and Teresa. I think that was an amazing session to look at how books are used by healthcare professionals, but outside the clinical setting necessarily, a more community-based view. And what I take from that, I think it was your terminology, Jess, that said grit and tenacity was important to make it happen. And for me, that resonated with what Miemie also showed us, that room full of people packing books in little boxes. It's like it needs to be mobilized. There's a model that needs to be kind of embedded. Champions are needed, people who really, really drive this and who continue to drive it. And so I think to make it happen and to embed it is not just going to happen. It actually requires a lot of tenacity, grit, hard work, effort. I also, for me, it was really interesting to see how, wrapping some guidance around giving books had a great effect, not just giving the book. And I think that was also said to us, it was also, just want to mute one participant. I think it was also in Katie's session where she showed from the research that that is what is effective. Yes, giving books on their own does make a difference, but books with some guidance, some modeling, some messaging, that is really where it starts getting embedded in routines and practices. And yeah, and the fact that you took from all these different parenting programs and different interventions, that the books can provide tools for meaningful engagement and play and fun. And we know that that is so very, very important at this age. So, yeah, I think it's wonderful. Let's hear if anybody has a comment or question for Jessica and for Teresa.
No comments or questions at this point.
Just lots of clapping hands and hearts.
Lots of clapping hands, yeah. And I think if anyone does have questions as we go through the sessions, feel free to just post them in the chat as well. And anything that, Jessica, if you see that you can answer instantly, head out and answer it. And on our end, we'll wait till the next speaker to then address those questions. Yep.
Yeah. Yeah. And Jessica said in the chat that joint planning has meant a lot to the facilities. I think getting people in from the beginning and helping, getting people to help make the plan, I think is really important. So thank you very much. And now I see we do have Bukle with us. Bukle is going to be talking to us briefly about the side-by-side campaign and how books and reading are being included in the campaign and in the campaign's messaging. Bukle, are you with us?
Yes, I'm here, Dorrit.
Hi.
Afternoon, colleagues. Thank you for inviting us and for having us. Thank you for such educational discussion. Can I just share my screen?
Definitely.
Perfect. Yeah, great. Thanks, Dorrit. So, colleagues, I am Butleba Mantunga Mabaso from the National Department of Health Side-by-Side campaign. And today I'm just briefly going to chat to you about what the campaign is and, as Dorrit noted, around our rationale for developing Pillar 2. And I'm happy to hear the rest of the speakers highlight the importance of reading and how health facilities can also kind of help be the spaces that move the reading movement forward, but also helps to keep caregivers and parents with the support that they need. So, colleagues, just a brief on what the Side-by-Side campaign is for those who might not be familiar with it. So, Side-by-Side describes the supportive relationship between the child and their caregiver, as well as the relationship for all of those who help to advise the parents. So in this case, Side-by-Side means the togetherness that we as civil society workers, as well as government, are there to help our caregivers and parents in their child rearing journey. In its essence, it basically takes us back to the old African ways that says it takes a village to raise a child. So Side-by-Side is a call to all government departments, as well as NGO partners, to work side-by-side to ensure that parents are supported in their child rearing journey, to ensure that from a government perspective, we have the services available for parents to access, and from an NGO perspective, that we are working in line with government to ensure that those services are available to parents and we are able to fill in the gaps where government is unable to. So the goal of the campaign itself is to ensure that all children in South Africa receive the nurturing care and protection to enable them to reach their full health and educational potential. So Side-by-Side is of the thinking that children need a full scope of services as well as help to grow. So starting from their nutrition up until to their healthcare. So the whole campaign is framed around the nurturing care framework pillars. And these pillars have been adapted to the South African context to speak to education on parents around good nutrition, what they should be feeding babies, how they should be feeding babies at different ages, to the love pillar, which was a first in South Africa, where we introduced it in the health sector to speak around not only tracking children's development, but that engagement and bonding that happens. So acknowledging that whatever happens within those first formative years around how children bond with their parents, stimulation being part of the bonding, helps to shape who they become in the future. Another pillar of the side-by-side campaign is protection, and this speaks to creating protective environments, firstly by ensuring that children receive the required immunizations, but also creating protective spaces in our communities, in our homes, to ensure that children are protected not only from disease, but from dangers that might impede their growth. And then our fourth pillar of the side-by-side campaign is healthcare, and this really speaks to education around for parents and caregivers around the healthcare practices that they need to be adopting to ensure that their children receive the best healthcare at a timely manner, and that parents don't usually sit with sick or injured children at home. And then our last pillar of the side-by-side campaign speaks to the extra care that children will need in assistance to ensure that they have the extra assistance. So this would be information around grants, around extra care for children who are born with disabilities or children who are born in special circumstances. This includes children who are born to teenage mothers or children who are born in homes with HIV parents or children who live with elderly parents. So the campaign ensures that there's information as well as referrals available around all of these 5 pillars. And at the heart of the campaign, we stress that the caregiver is central to their child's development, and that they need the support from every angle, starting from the home environment. They need to know what to do around the 5 pillars, how to do it, but also that they need the support in creating a healthy community. So the leaders in the communities, starting from our church leaders to our religious leaders and our traditional leaders, need to know the information around how to create safe communities for children, to support the parents that are raising these children. So at the heart of it, side-by-side recognizes that the caregiver is central to their child's development, and it's up to all of us in the sector to work together to ensure that these caregivers are supported with the resources as well as the services they need for their child rearing journey. So side-by-side's ideology is that if we make changes in the home environment by ensuring that parents have the information around what practices to change, what to implement, then there will be changes in how they interact and how they take care of children in the homes. And by creating resources and materials for our healthcare practitioners, as well as our CHWs, we're ensuring that there will be changes in the healthcare system so that when our caregivers come to our healthcare systems, they find working systems and working personnel to assist them in their child-rearing journey. And as highlighted, that also we understand the value of having communities that work. So we envision that if communities, starting from our leaders, as well as the homes in which these children exist in, if there's changes and everybody has an understanding of what needs to be done with each of the pillars, then there will be changes in the communities, ensuring that we have safe communities, we have an educated cadre of people that know how to take care of children, and we have resources available, not only in our health facilities, but in our DST facilities, as well as our basic education facilities to ensure that parents are supported and there's changes. So that's the impact models that side-by-side envisions. That if we do parent support through this communication program, then we will foster these changes in the home environments, thereby ensuring that the safe spaces for these children to exist in and they have the resources. So as noted, that side-by-side is a communications campaign journey. So at the heart of it, the Department of Health realized that parents needed the extra support when it comes to accessing information, when it comes to accessing resources. So we thought the Department of Health sits at a perfect position to be that support, to create that supportive campaign and communications program that will support parents. particularly because at least for the first 2 years of life, we know that parents and caregivers will be accessing health facilities. So it makes them the perfect point of contact for us to issue information and resources that parents might need. But also factoring in mind that research shows us that parents have parents kind of respect the information that comes from our healthcare workers, whether it be doctors or midwives. So again, it put these personnel at the perfect point to advise parents around what are some of the best practices they need to implement. And as such, then the campaign came about. So how the campaign works is if a pregnant woman or a woman suspects that she is pregnant, when she comes to our health facilities, the first thing she will do is be registered on our Mom Connect platform. So the Mom Connect platform is an SMS service that all pregnant women can register on to receive tips and information around how to care for themselves during pregnancy. So since we've started the side-by-side campaign and linked it to Mom Connect, we've ensured that the messages that also get pumped out through Mom Connect also include information around stimulation. As we've all noted, that reading starts from as early as when the child is in the mom's womb. So we also we send out pump out messages that encourage the reading and talking to babies while the woman is pregnant as a way of introducing that care and talking as well as reading to babies. So that would be our first point of contact where parents receive information through the Mom Connect platform. And then after you've given birth at our healthcare facilities, our healthcare worker will be the next point of contact who will give you our printed home materials, which would be the Road to Health booklet, which many of you would be familiar that the booklet was revised in 2017 to include the sections that I've just highlighted on the 5 pillars, with the Love, Play, Talk pillar being the first. So in the Love, Play, Talk pillar, our pillar 2, we not only stress what's important to health around the identification of developmental delays, but we've also purposefully included information around the importance of early stimulation. This includes storytelling as well as reading to children in that pillar 2, to kind of introduce the concept, but also to stress to parents that holistic development is not only about feeding children, but it's also ensuring that they are stimulated, starting from birth, starting from uterus noted, but also during the different stages of their lives, that they receive stimulation relevant for each of those age groups. So we use pillar 2 of our Road to Health booklet to communicate all of that. And the information, just to note, colleagues, the information around pillar 2 was very skimpy when we redeveloped the Road to Health booklet, particularly because it was a new concept that we were introducing in the health sector. And over the years, as we've been implementing the campaign, we've kind of realized the importance of further redeveloping the Pillar 2 app, which I will touch on later as I talk about the plans around that. So that's our Pillar 2, and then our Pillar 3 is noted as well. So all of this is contained in the Road to Health booklet, which will be given by our healthcare worker after you give birth at any public or private health facility. And then also we've got translated take-home materials, which is called the How to Raise a Healthy and Happy Child booklet. So we realize the importance of mothers and caregivers understanding the information that's in the new Road to Health booklet. As such, we translated the Road to Health booklet to be a caregiver pamphlet that can be accessed by everyone in communities. And that book is called How to Raise a Healthy and Happy Child. It's available in all South African languages. We are currently working on a Braille version of that. This is to ensure that all the information that's in the Road to Health booklet, including the tips, can be accessed by everyone in our communities and not only by the mothers who have access to the Road to Health booklet. And then we've got posters in clinics, which are also shaped around each of the 5 pillars. And I'm happy to report that Pillar 2 posters in our clinics were developed in collaboration with the Department of Basic Education, as we noted the importance of raising awareness around early stimulation, particularly within the first 1,000 days of life. And then we had a Road to Health booklet app that is back in revision, as we're trying to redevelop that app to be an app that sends prompts around what to feed children, the different ages, the different stimulation, including booklets that should be carried out at the different ages. So in the new version of the app, it will have all of those prompts. Mothers can access the app based on their children's ages, and they will access all information as well as resources pertinent to that age group. And then we've got a radio, which is our biggest reach that we use to reach caregivers. So the radio is divided into two formats where we have a drama. So you can think around this, around Skim Sam, around Sieven Delan. It's shaped like that, where we have everything that happens in communities. We've got the bad that happens in communities. And we've got the voices of reasons in the drama, which will be our healthcare workers, our community healthcare workers, and ECD practitioners that kind of bring order and highlights what are some of the bad that happened in each episode. So we've got a show in each of the 12 public radio stations, the SAPC radio stations weekly. The shows focus on each of the 5 pillars. So each episode will touch on 3 of the pillars. And I'm happy to report that since the start of season 1, we are now in season 5 of the drama. We have extensively touched on the issues around early stimulation, the importance of reading, where we have each of the characters. We've got children characters, different ages, just to highlight how parents should be engaging and stimulating children. So the drama models the behaviors and gives people characters that they can identify with. And then the drama is followed by questions and answers, whereby we've got experts from the Department of Basic Education, Health, DSD, that then engage our caregivers in their own languages around what happened in the drama. But also our audiences can then call in and ask around some of the tips that they need when it comes to better taking care of their children. And in 2024, we started what we called Reading Tuesdays in collaborations with the SAPC and Side by Side, where we were testing out the model of gathering, of having a story reader in the Side by Side episode and gathering parents for us to read one booklet. And then that is something that can be discussed on the station's social media pages around what the book was teaching the children and all of that. So that's something that's a plan that we are taking forward. In collaboration with the Department of Basic Education, we are looking at having their minister form part of those Reading Tuesdays. And we are looking at having them as a stand-alone, whereby every parent can know that at certain times, if you tune into an SAPC station, you will have the Reading Tuesdays, sort of like a book club for different ages. We will engage parents around those booklets. So that's the radio, and the most exciting piece. We reach about 5.4 million homes weekly through the stations of broadcast. And then the nice thing about that radio drama is that because radio reaches even the far most communities in South Africa, but also because people have formed relationships with the presenters on radio, they're most likely to take the advice that comes from the producers, which is why we also work in collaborations with the producers to have an understanding of, when we speak ECD, the importance of stimulation, so that they can be our champions during those radio shows, and they can be able to convince parents around what we're trying to get across. And then lastly, the side-by-side campaign uses digital media to now tie all of this. So the messages that are in the Road to Health booklet would be the same messages that are across all of these platforms. So we use social media as a two-way communication to also gauge what the parents want more around. And that is mainly the Facebook page. We opted for the Facebook platform because it's free to access, meaning our parents without data can still access the information. And yeah, we use that Facebook platform to also get parents to inform us around what they would want more information and resources about. And I'm happy to report that the parents are coming back to ask us where they should be accessing more resources around reading, more resources around storytelling, which then prompted us to look at the redevelopment of Pillar 2, as noted. So our Pillar 2, as noted to you colleagues, is the perfect place to integrate health services and early learning stimulation. So while the Department of Health is focused on identifying developmental delays, this Pillar 2 can also be used to encourage and support early learning and development in the homes. As noted, how we've been able to use it in the past in the radio, and also on social media, where we have Love Play Talk Tuesdays. So we use Tuesdays to get information around the science of why we're saying read. So as side by side, we work on the premise that we first understand our audience around what are the barriers that stopping them from reading to their children. And then through that understanding, we then craft messages as well as resources that help these parents. So we've moved past the point of educating our audiences, and we are now offering them the tips how to, as well as the resources. So we've been using partner resources from Nadibadi as well as Book Dash to kind of fill in those gaps of parents asking us where they can get the resources. And using social media, we've been using Tuesdays to share those tips on how to create books in the homes, how to access the books that are already available, and how to stimulate young minds using stuff that is available at home. So future plans for our pillar 2 is to have that Story Tuesdays, as noted, to involve key principals in government like ministers to then encourage that reading club. So ideally, we're looking to have a reading club for each different groups that will solely be on our digital pages as well as on the radio. And then, yeah, we'll use it to share what you should be reading to children at 3 months and going upwards, using those Tuesdays across all the platforms. But also, a thing that we had tested out was having reading clinics in our Ideal clinics. We had piloted in 2 clinics, 2 Ideal Health clinics, where we'll have reading corners, where we had Nadibali supplements and we had some books donated. Can't remember the name of the organization now, but they had donated books whereby we put them in our reading corners. So parents who are coming in for regular checkups would take some of the supplements. We had a story sparker that was engaging parents there in our Ideal clinics. And we think that this is something that can be upscaled in most of our Ideal clinics, but that requires resources in the forms of story sparkers. So we saw when we have somebody that was leading the stories, it was also beneficial for parents to see how to engage in those stories, but also having the resources there. As noted, as much as we share on the digital platforms, parents have also stressed the need of having takeaway materials. So yeah, the idea of the reading clinics is something that we are keen to explore, particularly in our Ideal clinics, to further feed in and complement the plans that are happening on social media, as well as the radio platforms. But also just to note, colleagues, that we are also in the process of redeveloping the side-by-side website to make it a hub where parents can be sent there to access and download all the resources. So the Department of Health is making the side-by-side website a data-free access so that parents can access all the information there for free. And yeah, it can be used as a hub for everybody to refer people there, for caregivers and parents and practitioners to access any of the information. And to note, all the information is available in all South African languages. And yeah, colleagues, in a nutshell, that is what Side by Side is. And that is just some of the materials that are available in the clinics and on the website to be downloaded by partners to share and yeah, to use in their programming. Thank you so much, Dorette. I hope I've touched on everything.
Thank you, Bushle. I think it's amazing to get this very systemic view of messaging around reading, and the various ways, the various kind of touch points and ways in which you're reaching parents and caregivers with the Pillar 2 information. I think it's been wonderful to hear, and obviously, I think many of us have an ideal where books can be systematically and systemically become part of the support that we give to parents. And so I think it's just really useful for everyone in this room to understand what's already being done and what all the kind of frameworks are, and the excellent messaging. On this slide is, for instance, that's from an Instagram post. Sorry, an Instagram post by Side by Side. And I think the messaging is really very wonderful. It shows a very young child and a mom. It shows them in close physical proximity. You can see the bonding. So I mean, I just love the communications that Side by Side is putting out. And thank you very much for sharing with us all the different angles to it. Much appreciated. Right. Now I'm going to just take us very briefly, 5 minutes, through something that I think Jessica alluded to when she said that the reporting that we ask for as Book Dash to organizations that receive books from us is not meant to be onerous. It collects responses to 5 or 6 different questions. We ask everyone that receives books from us once a year to complete a Google form with the same questions. And we have had qualitative feedback of this nature for, I think, 6 years now, using the same standardized instrument. And we love reading those responses when they come in because it gives us a textured understanding, it gives us wonderful glimpses into how the books are used. But after 6 years, we do have a mountain of that qualitative feedback, and it's a little bit unwieldy for us to really use. And so very recently, we asked our M&E consultants, Robin and Chris Pocock, to help us analyze this fantastic treasure trove of qualitative feedback. And they constructed an AI-supported thematic analysis of all the years worth of qualitative feedback. And I thought it would be very interesting to share it with this group very briefly. So how do the books support your organization's programs? That is a question that we've been asking all our distribution partners for many years. And you can see on the graph the different themes that come out of a thematic analysis. And obviously the 72% of responses comment on the fact that it helps to develop literacy and language skills. It supports that aspect of a program. To say also that what I'm showing you is we've filtered our analysis to only show responses from our healthcare partners. And so it's no surprise that of these responses that come from the healthcare sector, 62% of the responses talk about supporting therapeutic and holistic well-being, and that's how the books help. And you can see the theme descriptor. It's about describing the use of books to support children's emotional, social, and physical health, particularly in medical or therapeutic contexts like occupational or speech therapy. Books are used to promote imagination and creativity while providing comfort, hope, or distraction during illness or trauma. We also have, for each of these responses, for each of the themes, we've got a representative quote from one of our partners. I'm not going to read them to you, but we will share the presentation so you can have a look at them. Next slide, please, Andri. Another question that we ask every year is, how do the books support your promotion of reading and family literacy practices? We know that strong family literacy practices help to support strong family practices, and that is really beneficial for a young child's outcomes, whether it's health outcomes or early learning outcomes. And so again, these are filtered for our healthcare partners. 87% of the responses contain the theme of physical access and book ownership. I think something that Bukhle just said now also is there's a lot of messaging about reading and about how important it is, and parents and caregivers are asking for take-home resources, and we understand why when we think back of Katie's presentation of the very low levels of book ownership in South Africa. So it's one thing for parents to understand that it's a good thing and important and it's really fun and wonderful to read, but it's really sad if they don't have anything to read. So these responses comment on the fact that it actually just increases physical access and book ownership. And there's also a lot of therapeutic integration. No, it's fine. Let's go on to the next one, Zandri. What was the reaction of the children receiving and reading the books? Here, 85% of the responses speak to joyful and animated responses, high energy, emotional affect, outwards expressions of happiness, jumping, laughter, excited smiles. Those were all the things that fed into this theme. Again, I think it speaks to the fact that for many children receiving our books, it's the only book that is in the household, or it's the first book in the household. And it's very often the first book that they own, them as an individual child. And that explains these responses. The next one, please, Andri. Tell us more about how the books are used by children and families at home. Here you can see lots of different themes that kind of came up in the feedback, but the one that was present in 70% of the responses was it strengthens caregiver-child bonds. I think this has been said over and over again in this session of the amazing advantage that books provide because they can spark this bonding. I think that was the last one, Zandri. Yes. So I'm not sure whether anyone has questions about this. It's an incredibly valuable tool for us to see what themes emerge from the people who are using our books. We can filter for our ECD partners, our healthcare partners. We can filter by year, by province. So it's a very, very useful way of dealing with a lot of qualitative feedback that we get from our wonderful partners. Right. Now, we've got a few minutes left to tell you how you can access Book Books if you're not yet a distribution partner. So we're going to zip through this. Zaib is first going to tell you how you can become a Book distribution partner.
Hi everyone. So we, as Bookdash, we can only do what we do with the wonderful network of partners that we work with. On our website, you will find a lot of information about how we select a distribution partner. So there are a few criteria that we look at, and that's listed there. But more importantly, we have a window that we have opened or will open later this year from 1 September to the 15th of November. Applications will open, and we will send messaging on our social media as well to let everyone know that they can now apply to become a partner of ours. And also on our website, you will find a link where you could let us know whether you want to be notified. So you can fill in a little form for us, and we'll let you know that the applications are open, and you can then, and we'll then let you know when you can apply with us to become a distribution partner.
Thank you, Zaib. I'm putting a link in the chat with a link to the website. Then, Zandri, if you can just share your screen again, please. Because
Yes,
I can't
sorry.
remember
I
who's
couldn't.
next. Oh, you
Yes,
are
yes,
next.
it's
Yes.
me, but I couldn't. I had to unshare to put my video on.
Okay, good.
Hi, everyone. I'll tell you about, some of you might be familiar with this already, but not only do we print and distribute the books to our distribution partners in South Africa ourselves, but all our content, all our 200 plus books are also available for free online. And not only are they digitally available and for free, but you can also print any of our books yourself. So if you go to the Open Content Partners page on our website that Dorette will add, that will put in the chat, you'll see all the different possibilities of an open content partner. But basically, if you see that you don't fulfill the requirements of becoming a distribution partner yourself, and you rather want to print these books in your own capacity, you are perfectly able and welcome to do that. Or if you are a distribution partner, but you also want to print big books or in another format, or you want to add to the books that you receive from Bookdash, or you want to print books that, that's not available this year, but you like a specific book that you want to include. For example, the Brave Bora one that's specifically about vaccinations in a clinic. Or if there's anything that you specifically want to provide to the children in your communities, you can print any of our books and distribute it for free or even sell them. We have a template that makes this very easy for you to do, because we know not everyone has dealt with printers or copy shops to print books before. So we have a very easy template to fill out and send to a printer or a copy shop around the corner. That makes it easy for you to communicate with the printer so that they know exactly what the requirements are to print the book in exactly the same format and style and quality as the Bookdash books that you will be receiving. Anyways.
Thank you, Zandri. I put a few links in the chat for people to click through. And then the other, my turn. You can also purchase books from Bookdash throughout the year. We keep books in stock. Those books are slightly more expensive because we, of course, have costs around stock holding, etc. The best thing to do is to email us at team@bookdash.org. And Zaib will tell you what we've got in stock and take you through the process. We also have 2 points in the year where you can get our books at discounted prices. The one is a kind of big annual partner print run that we run now in May or June, but we already start collecting orders for it a lot earlier. And that is where you can participate in a big print run and get the advantage of economies of scale. So small orders add up to a big print run. The second point in the year is our sale, which is in October, November. And there again, you can order from stock, but at a discounted price. Sherry, would you like to talk about the dedicated print runs, please?
Yes, I will when I've finally unmuted myself. We also have an option for customers who are in the exciting position, well, partners really, who are in the exciting position that they might be able to print larger quantities of books. And again, Zanri, I'm not sure if you were going to show the screen from the website.
No, I don't think so, Sherry. We don't have time for that. I've
Okay.
just put the link in the chat. Yeah.
Okay, great. There's a link in the chat for you to look at. And we are in the position of printing larger quantities specifically for a partner who has the funds to print. We only deal from a number of 10,000 books. And there is a specific area on the website that Dorit's given you the link for that explains the process and explains the cost per copy so that you can work out your budget.
Thanks, Sherry. Yes, that's a very good option if there are very specific titles that you're looking for instance, or in specific languages, and we don't have stock of that. So that's definitely also an option. And then, Tembi, over to you for our last bullet about joint funding proposals.
Thank you so much, Dorit. And really, thank you again to all of our presenters that presented today. The modalities and the way that the programs are carried out, the embedding of books is really unique. And that brings me, to that last point that it takes a village, it takes a community, and all of the actors in the ecosystem to ensure that the children have the right start. So we often have partners that we will bid for proposals together. So for example, the book dash contribution to a joint proposal would be the books that we are putting in the hands of children. And part of that collaboration includes sitting down with the partner, understanding their interventions, what are their needs, and mapping out the titles that are most suitable for the program that the partner has. Our team has done amazing work in making sure that our books on our website are categorized around thematic areas. So it makes it simple and easy for any organization to look at the themes. And in that exploration, we can explore together how we actually find the right books, whether you're talking about stunting or you're talking about nutrition, or even just books that help unlock real catalytic conversations with caregivers, emotions, children's taking up ownership and responsibility for themselves, like dressing themselves, things that are really, really, we don't think about. We've got so many titles. So for any organization that does want to partner with us, that does want to sit down and see how we can collaborate on projects, you're welcome to reach out to us on our website via our team at book dash email. And between Dorit and myself, we'll have conversations on what that could look like. Another way we've partnered in the past has been through dedicated campaigns. So we've partnered with public sector on campaigns around the first 1,000 days, linking the library systems and linking the healthcare systems together. And these are always conversations we are open to having and working with organizations together. So Dorette has put up all of the links in the chat. Please feel free to reach out to us and share with us on how you'd like to walk the journey and all of the various methods. We're here and available to share what options might be best for you and your organization. And thank you so much, everyone, for attending. And thank you, Dorette.
Great. We are 1 minute over 12. If you've got further questions and answers, I think it might be best to email them. We will share the recording as well as all the presentations. And thank you so much for attending, for giving us 2 hours, very precious hours of your time, to explore this further. It was really very wonderful to have everyone here. And thank you so much to all the presenters. There are our contact details, team@book-org, if you want to get in touch to explore any of those ways to get hold of books in more detail. Thanks very much, everybody, and have a lovely, what are we? Tuesday further. Bye.
Bye, everyone.
Bye, everyone.